we will begin again with Michel Gaudet, who will come and present to you the ECOASIS project. He is working on environmental projects for the last 30 years. He has played a key role in the ruling on pesticides in Quebec, and he is currently one of the founding members, vice president and general director of the association, the Environmental Health Association of Quebec, which is working towards the respect between on the link between the environment and human health. Monsieur Gaudet, I invite you to come and take the floor. Thank you. Hello, I am Michel Gaudet, Vice President and General Director of the ASEQ. Next slide. The mission of ECOASIS is to provide and operate affordable, healthy residential accommodation and incidental facilities exclusively for persons of all ages, disabled from multiple chemical sensitivities and earning low and modest or low and moderate incomes. Next slide. What is healthy housing? Healthy housing is housing that is free from perfumes, scents, or fragrances, and that uses only healthy, least toxic products for all requirements, such as personal use for cleaning, maintenance, pest control, furniture and furnishings, etc. The basis for construction or renovations of a healthy house or building is source control, or more precisely, choosing appropriate, less toxic material that is hard, for example, steel, glass, etc., and does not off-gas chemicals, or off-gases are low levels of volatile organic compounds, VOCs, for a short period of time. Before I continue, I must explain off-gassing, or what it means to off-gas a product. Generally, the term off-gassing is used to describe the emanation of chemicals from a product that one can generally smell. For example, the new car smell or a new product smell. To off-gas a product is to deliberately use methods such as heat, ventilation, or other means to allow for the chemicals or smells to leave faster. This is usually done with good ventilation or outside the home so that the person affected does not breathe in the off-gassing chemicals. Of course, when these chemicals leave or off-gas, they become part of the larger environment and can be carried to distant places to affect other life forms or the environment. Therefore, product choice is very important. One cannot rely only on ventilation for good air quality. As the slide says, dilution of pollution is not a solution. Choosing building or construction materials is the basis for success in building or renovating for people with multiple chemical sensitivities and other conditions that require healthy spaces. Why is this important? The answer is simple. Products, whether personal products, cleaning products, or those used for renovations or construction of products, cleaning products, or those used for renovations or construction off-gas and become part of the indoor air. We all have to breathe, and for those that depend on good indoor air quality, failure to use such choices at the source and in daily living could lead to a lack of inclusion and accessibility. And for people with multiple chemical sensitivities, it can even exacerbate their disability and cause them further harm. Therefore, great care must be taken in the selection of hard materials that do not off-gas and the selection of products that have extremely low emissions, keeping in mind that an off-gassing period will be necessary before the indoor space is acceptable. The same is true for equipment brought into a building or house that may be coated with or contain petrochemicals, oils, or other substances on them that emanate VOCs. These equipment must be cleaned or burnt off outside of the living space, usually by running them outside the building or house, in order to allow for accessibility for vulnerable populations and for people who require clean air. It is also necessary to have fragrance, scent, or perfume-free policies, as well as policies on least toxic choices for all uses and applications. This will be written into our lease to protect each individual and the project and will apply to everyone within the community and those that visit or work within the complex. Next slide. The journey of ECOASIS began alongside the start of our association in 2004, when we sent out a survey to our membership about the most urgent needs. What came back was a desperate need for appropriate housing. At that time, the prevalence of diagnosed multiple chemical sensitivity cases in Canada was close to 600,000 and in Quebec close to 200,000. Today, the diagnosed number of cases in Canada is over 1.1 million and over 250,000 in Quebec. The challenges for this project were finding the political will and a suitable area away from pollution where we could build. We began to look at the possibilities of where this project could be located. While living in a city has its benefits and outdoor pollution can be controlled indoors using filters and air purifiers, the outdoor pollution would leave the occupants prisoners within the complex, since going outside would make them ill from exposure to the polluted city air. A location within the suburbs was also problematic, since the chemicals used inside the houses for cleaning and personal use off gas to the exterior and contaminate the outdoor air. Furthermore, there are often small industries with polluting activities located within the suburbs, and pesticides originating from golf courses and farms are not uncommon. Excuse me. So we had to go further to find clean air. However, this also posed a problem, since remote areas often do not have any infrastructure such as water, sewage, and electricity. These elements increase the cost, but it is the price to pay for healthy living away from pollution and polluting activities, and to hopefully recover from multiple chemical sensitivities or manage the health condition better. Furthermore, building housing with healthy materials increases the cost by approximately 30%. The choice of a remote location and healthy building materials therefore added an additional challenge regarding funding. Next slide. The project received a boost both in terms of value and encouragement when 25 acres of land in the Laurentians were graciously donated to ASEQ-EHAQ in 2011 by an individual. It is a forested area and is free of known sources of pollution. The zoning has been completed for the land, and we have the support of the municipality for this project. Funding availability was identified from the Société d'Habitation du Québec for a Volet 3 project, which provides additional support, assistance, and funding, and is suitable for a vulnerable population experiencing homelessness, poverty, and disability, and from the Canada Mortgage and Housing Corporation for an innovative project. Agreements had been made for product selection with large companies and for additional donations to the project. Next slide. ECOASIS could very well be a pilot project for people experiencing multiple chemical sensitivities who are disadvantaged and neglected and who are in dire need of healthy housing to be able to live without being triggered by symptoms from exposures to chemicals found in commonly used products. The project is not about constructing buildings, but it is all about building a community. And why is this important? Often people experiencing this disability have suffered great losses in their lives from the inability to gain access to healthcare, essential services, places of learning and worship, and to the community at large. Many people with MCS have even experienced homelessness of some form or the other, such as living in their cars, in tents, with their windows open, even in winter. And all this can be also take place in couch surfing, moving often, and living in places where the rent is beyond their means are all forms of homelessness. The ECOASIS project is a chance to rebuild lives and show a new way to build for a future that is respectful of our environment, flora, fauna, and health. We have already touched on location, so I won't go too much into detail, except to say that location is very important for the success of the project. The land is big enough to provide residents with protection from any possible pollutants. There will be 40 units built on 2.5 acres of land. The rest of the land will remain untouched, except to replant trees that have fallen. The basis of this project is the choice of materials. This process has already begun, and we've been working with experts and people with lived experience to develop a list of suitable products. We rely on product reporting from members who experience the disability of multiple chemical sensitivities and from other sources. While there could be an off-gassing of chemicals, period, our aim is to get the least toxic and healthiest products, not only for initial construction, but also for potential renovations. The community hall is vital for inclusion and for building community morale. It will also create the opportunity to have gatherings, events, educational tools, and the chance to return to life in the community. Events for the surrounding community can share knowledge on healthy living. Organic gardening can supplement the community's food needs, and the trails will be a welcome addition throughout the year, as the multiple chemical sensitivity community is always looking for healthy spaces to exercise and be in nature, where they are not exposed to the products used on passersby, such as perfumes or other products, such as insect repellents that provoke symptoms. We are currently working on putting together a research plan to replicate this project across Canada. Over 1 million people are diagnosed with this disability, and housing is an urgent need and a basic right. Next slide. Why does ECOASIS need to be affordable? If you take care of the weakest among us, you care for everybody. Let's find out a little more about the multiple chemical sensitivities community. According to the 2015-2016 Canadian Community Health Survey data, 41% of Canadians with multiple chemical sensitivities cannot work, compared to 24% in the general population. 34% of people with multiple chemical sensitivities with post-secondary or university degree are not working, compared to 18% in the general population. In addition, 50% of women with multiple chemical sensitivities and with similar degrees are not working. Furthermore, people with multiple chemical sensitivities are more likely to experience poverty. For instance, 26% of people with multiple chemical sensitivities earn less than $20,000, and of the 41% of people with multiple chemical sensitivities who cannot work, 65% earn less than $20,000. The percentage of people with multiple chemical sensitivities living in poverty is therefore 20% higher than the general population. Slide 8. This slide shows the location of the buildings on the land. This will change when the final architectural plans are done. What you see here is 10 buildings with 4 individual units per building. There is a community center, organic gardens, and trails. The project is based on sustainable practices and includes bioclimatic principles, which are choice of land, solar energy, wind direction, the orientation of buildings, drainage, and protection of natural spaces. It is also based on eco-construction, which includes choice of materials, eco-management of the worksite, regular maintenance, and the impact on the natural environment. A key factor is the quality of the environment, which includes being far away from pollution and which depends on good indoor air quality, control of humidity, and sustainable landscaping. In order to foster a spirit of community awareness and education on healthy living, regular workshops will be held, including on the importance of organic food and least toxic cleaning and personal products and other topics of interest to the tenants. Years of effort and work have gone into this project. Our aim is that ECOASIS will be a pilot project that can be replicated anywhere in Canada. Slide 9. An innovative project such as ECOASIS requires a research project that records and monitors prospective tenants before and after they move into ECOASIS. The methodology for choosing healthy materials and investigating the volatile organic compound or VOC content is necessary, as well as measuring VOCs at various stages of construction, and if necessary, finding effective, efficient methods of off-gassing such chemicals from the indoor spaces. It is also important to measure quality of life before and after moving into ECOASIS, and to measure health status before and after, and even for a few years to measure health outcomes. Next slide. ECOASIS could be an example of how to build for the future with the least toxic choices that protect our environment and the health of living beings on this planet. Equally important is that it will be home to a neglected, disabled population that is growing in numbers. The call for healthy housing is growing louder, and especially for people experiencing multiple chemical sensitivities. Let us all work together to make this a reality. Thank you.